All right, good evening. This is the Board of Health meeting, Town of Northborough for November 12th, 2024, 6:00 p.m. For the record, this meeting is being broadcast live on YouTube and also being recorded. We're just going to take a roll call of all the people here, starting at the end of the table. Why don't we just go right away?
Or
Just
board members?
Just board members? Okay,
Swati Sane present.
Lee Jane present.
Glenn French present,
Teresa Capobianco present. Lisa Johnson present.
all present and accounted for. Moving right along on the meeting agenda for the evening, this is amended. We're gonna start with the HHS staffing update. Community Outreach Coordinator Liz Nolan.
Yeah, so we have hired our full-time community
Wonderful.
outreach coordinator, Liz Nolan, if you want to do a little intro.
So yeah, I'm 2.5 weeks in. And it's actually been great. I've been able to meet with a lot of different people. And I mean, the big thing is to bring awareness to the department. That was lacking. And just trying to let people know what we do, what we offer, what kind of resources we have available. So we're putting our plan together. And Isabel has been just a great resource as I'm getting my feet wet into everything. But I've lived in Northborough for 18 years, so I know the community well. I know a lot of the organizations in town, and it's great to have that kind of network and system. We're just trying to get them to work together to a lot of them deal with the same thing with families that way.
And tell us, Liz, where is your office located?
It is upstairs on the second floor.
Okay, the top.
Oh, the second floor.
So she's right next to my office, me, Emily, and actually our next update, our shared service coordinator / epi role. So that was my old role. We actually hired someone. Her name is Michaela Petty, and she'll be starting on Monday.
Okay.
So we're slowly filling our department. So she is fully grant funded. So she's working on that public health excellence grant, as I was. So she'll be starting on Monday. We have 2 open roles. We have a full-time regional public health nurse that is still open, and then our full-time social worker, which is also. So if you know anyone, let us know. Michael and I are actually going to a conference in Springfield tonight through Friday. So we're gonna do some networking to see if we can get some new applications. But that is kind of
You're going to Springfield this evening?
yes.
This one have to drive in the morning.
This is dedication.
So make it quick, no, I'm kidding. So those are our 2 open roles, hopefully we will hire soon. And then I think the last Board of Health meeting, we talked about that Northborough and Southborough shared health agent role. So Southborough is gonna be the hiring agent, so we did some interviews and they are going to make an offer to one of the health agents. So hopefully we'll have give Michael some help, increase our capacity. And slowly but surely, we will be a fully staffed department.
Excellent.
Took a lot, but we're getting there.
We're getting there, yeah. Come a long way.
Mm-hmm.
Right, anything further?
Anything from the team? No?
No? No, let's go on to community fridge food safety guidance.
Thank you, Mr. Chair. As you may all probably know that there's a community fridge on the corner of Pierce Street, down here right in the parking lot of the food pantry. Opened, I'm not exactly sure when, before I started, but not too far, so 3 years maybe or so. And when I was contacted originally, they had asked about some guidance. And I said, you can't have X, Y, and Z. I went straight by the actual food code, by the laws of food safety out there. I received a little bit of pushback at the time, but the health department food safety was the #1 priority, and I went right by the code. Since then, there's been a few new people that have been, few new organizations that have been overseeing the community fridge. And one of them recently reached out to me and pushed back a little bit more about what a community fridge is, its purpose, and why that as a health department, I should allow. I won't say bend the rules of the food code, but understand that a community fridge may be a different animal than a restaurant. So rather than me make the final decision, I figured Isabel and I would come to you folks to describe it a little bit more and ask your opinions. about what we should do. In its essence, community fridges are simply what it said, it's a community program that is to help work with food insecurity. And it's the donations of people that have extra food. Generally, it's more of a baked goods or canned goods and things like that. So the question here is if it's a perishable item, are there a few things that are allowed in some community fridges and not allowed in some community fridges? And I didn't feel, again, I had to make the decision, so I was going to. So. Any questions at the moment? I'm going to explain a little bit more in a second.
We'll wait, I'll wait.
All right, so the first item is, she asked me if people could donate raw chicken. Like you buy a package of Purdue chicken at Walmart and bring it to the fridge and put it in.
Freezer or fridge?
And either one.
It's the transport of that chicken that
Right,
gotta
so
work.
from a food safety standpoint, there are concerns because we do not know how long it's been out. That the person who's delivering it is doing the right thing. That maybe they've been driving around in their car for 2 hours before they put it. So that's certainly the concern with the raw food. The other two bigger items is homemade food. Most of the places that do allow it you can't just throw anything. It has to be in a container. It has to be with a date you made it and labeled with allergens, not full ingredients, but say sesame seeds, nuts, so forth and so on. And then the third kind of item is sort of like leftover food, not the food that you just ordered for your family at your Chinese food, but more if there was a catering event or a work event after work that we could bring over the leftover trays of food or sandwiches or things like that. Some community fridges are run by towns or has more town involvement than others. Some are very hands-off. So it's hard to get a tremendous amount of information about other communities. I looked on the web, online, about 2, 4, 6, 8, 10, about 18 different communities that did have things posted. Not everybody said all of their rules online, so I don't have a tremendous amount of solid information. So for example, with the raw meat or poultry or something like that, out of all of those 8 communities absolutely said no. 3 communities said it's okay, and the other, 6 or 7 didn't have any guidance. So if it doesn't have guidance, I guess you can interpret it however you want. Nowhere did it specifically call out you couldn't have non-perishable raw food. So you could read into those what you will. Rhode Island itself is the only community I went out of Massachusetts because, because it's close to us, I guess. There's no better reason than that. So they say it's okay. The town of Watertown says only if it's frozen. And it can be transported. If you bring it frozen, it can be put into the freezer. And then the town of Hudson allows it. And again, 4 other communities say no. The frozen, again, theoretically, it could have been fresh. You could have had it in the car for 3 days. Then you froze it, then bring it. So, I don't know if you'd like to just address one at a time. Like
Each individual food.
No, so raw meat, poultry, seafood, homemade food, and then leftovers. Do you want to address one at a time or give any thoughts on it, please?
Basic question, is this part of the food pantry, an extension
No.
of the Northborough Food
It's
Pantry?
completely separate.
Who runs?
They helped donate some of the money to build, if you saw originally, it was just a store-bought fridge from Walmart or something that had a basic structure around it. The food pantry helped get a grant and they contributed a little bit of money to buy a nice new fridge with and paid a contractor to build a lovely new structure. Who runs it now? I'm honestly not 100% sure, but the Northborough Junior Women's Club is the main people that do it. They have volunteers come in twice a day to monitor temperatures, and they have people come in at least once a day to make sure that everything is expired, is thrown away, and it's kept clean. So from a safety standpoint, the fridge itself, I feel is monitored properly. As I said, it's monitored for temperature, it's monitored for cleanliness and expired food on a daily basis. So that's where the fridge itself stands. I'm not sure who I spoke to or what her organization, Cheryl Silverberg, do you know who she is?
Yes, she's with, I think she's with Junior
Junior
Women's
Women's Club, okay.
as well as
She might just be
Trinity
the person in
Church.
charge. So the food comes from, like I said, from any resident that tends to donate.
So is it like a home refrigerator or is it
It
like
is.
an industrial?
It is.
Okay.
So the three towns that say it's okay, do they have any guidance as to what criteria allows them to say it's okay, or they just said, nope, you can
Just
just,
so it's.
okay, it's just blank, whatever it is.
So the people that fully support community fridges, I didn't print it. It's a community fridge which should follow community guidelines and should be bereft of all legal and regulations and laws and that kind of thing. It's a movement called Food Freedom, that basically should be allowing anything to happen specifically in community fridges. In other states, that has expanded into residential kitchens where people can make chicken pot pie and meatloaf and so forth and sell it on the street corner, farmers markets. Residential kitchens, as you may know, in Massachusetts, you can pretty much only bake like cookies, cupcakes, and cakes. So it goes along with that. This is the food freedoms of allowing residents to produce food, especially for a charitable purpose. One of the other arguments people will give is they will point to Mass General Laws Title 15 next week, 15, Chapter 94, Section 328, that says the preparation of food in private homes for donations shall not be subject to regulation. Does that count as a donation? And that's where the gray area comes in, where yes, the food code is very fairly specific, but this is a charitable nonprofit donation event, sort of. But it's being held as opposed to served immediately. So, as the food safety professional, I would tend to follow the food code more and say that the fridge should only have non-perishables and canned goods for the most part. But I understand.
So you
community
don't
as
know
well.
eggs or anything like that?
Eggs are allowed. Well, we could theoretically discuss that, but I would have allowed eggs. But you're right, those are very valid. That's one of the things, I think one community said no eggs, but everybody else called out eggs as an allowable.
What other items would I find in the refrigerator?
Produce,
Produce?
produce and bread and dairy products. And we could have the same conversation about milk, but those, again, theoretically are allowed because there's less of a risk of foodborne illness. And hopefully, you may carry around your chicken in the back for a while, but you think milk in a different way, and you might not do that if that makes sense.
There's no expiration date for pies that are made at home.
Theoretically, those shouldn't be allowed because it's still made at home. But that's where it gets, when I just read about the laws, during Apple Fest, when the Junior Women's Club had their apple pie contest, that's allowed. With a sign that says this was made in the kitchen, not inspected by the health department. And theoretically, if your church has a potluck where you make a chili and you make it's almost not fast enough, chicken noodle soup, that's okay to bring, and you can serve it to people at the
So where is this food donated to? Like to?
It's put in the fridge. You would drive it
So I can go and get what I want?
anytime you want. It's open 24 hours.
I see,
So if you're facing food insecurity, you can drive it to the fridge and
got it.
if you need some bread, hopefully there's some bread in it for you.
So it's open 24/7?
It's just in the parking lot of the food pantry. It's at the food pantry, but that just happened to be the landlord of that property, Tim Shea, some of you might know who he is. I don't even know who started it originally, honestly. I think that when I started this job, the Fitzgerald Institute was in charge of it.
You started.
They started, okay, so the Fitzgerald Institute started.
And how do they track who takes what?
They don't,
So somebody just drives up there, goes to the fridge, takes what they want, and that's it. So if there's an illness that comes out of that, who cares?
if you're a person who doesn't care as much about the community, you could empty the fridge and put it on your car. That would be morally wrong, but
No, I know.
really wrong with it.
But my point is no tracking of any potential foodborne illness like that.
No,
And when the temperature is checked, do
We
they
don't
check
know
for the
who's putting it
expiration
in or
date?
when putting it in.
They check the
they,
expiration date
not-
of the eggs or the milk?
Yep.
Okay.
when
It's supposed to be
the
part-
volunteer goes to
Yeah.
look at the fridge,
Right,
whenever it's their turn that day.
Charity things.
They check the temperature,
No
they
regulation.
check the expiration dates, and they wipe it down, if there's no spot for cleaning someplace.
Poses a health concern to the community, that's
why
why
it's
it's here.
Hmm.
But it does fall under that, I think it falls under the charitable donation.
That's where it gets
That's where I'm.
fuzzy, and that's what I do when I take the decision.
I have a couple questions, yeah.
Please.
Sure.
So if we say, yes, chicken can go in the fridge. What's our liability for that when somebody puts bad chicken in the fridge and somebody else takes it, it
Zero.
can be very sick, okay.
Will it be a PR nightmare? Maybe. Would we be responsible for someone getting sick? Yes, theoretically, but civilly liable or any of that kind of stuff, absolutely not. There are laws against it.
Okay.
I didn't print those or pull those out, but there's actual Mass General laws that remove any civil liability from anybody.
Okay.
Who donated food or something like that. I can forward it to you.
I've never had to look that up, that's why I asked
Yep.
it.
Very valid question.
Okay, in terms of the food prepared at home, is there any way to track who's bringing that in? We don't necessarily care who's taking it out, but maybe.
I
who's
mean,
bringing it
if-
in.
You wanted to allow it with a caveat that they had to sign in or something, or theoretically, yes, but no, not in general.
Are there cameras in there?
I did not require them and I honestly don't know. I do not believe so.
And right now, are we allowing milk?
Dairy
Yeah, we're
products.
allowing all dairy
Well,
things.
yes,
Is there a way to say we can accept fresh chicken if it's within, obviously within the expiration date on the package? Or actually fresh or frozen?
I mean
Within the
theoretically,
expiration
we
date
can
on
do
the
whatever
package.
we want. I mean, it is a legit concern about someone not handling it right, but how much of a concern is a legit?
I don't suppose we have any data on how many times there's been a bad chicken problem or a bad beef problem or anything like that.
All the information I've got said it's never happened, and there's no data on it, but that's, the CDC hasn't studied it or something like that, so it's debatable, the information that I was getting.
I mean, I certainly understand the need, but I used to volunteer in food pantry in the Metro West community. They did have fresh chicken and hamburger available to all people who would come in. But we got that directly from the store, so people would donate money specifically for chicken, beef, and fish or whatever. And then we would get that directly from the store for handing out.
That's a good, the food pantry does have that, because it comes directly from Walmart or BJ's or whoever they have.
That was my question was, if I'm food insecure, where can I get the chicken to go with the bread and the eggs, so to speak?
Food pantry is only open 6 hours a week.
Yeah.
Wednesday nights for 3 hours and Thursday for 3 hours. Lindsay, nodding yes.
I
Give or take an
I
hour.
wanna say
I think it's even.
Short, even shorter than that,
Yeah.
but at the most, it's Wednesday night and Thursday morning for just a few hours. each. So that's the benefit of the community fridge, that people can't make it to the food pantry that night, that they have access to some. At least bread and produce, if that's, as much as we decide to go with. A similar amount of people said no to homemade food. Worcester allows it as long as it's labeled and dated properly. 6 communities said no, and then 5 just didn't call it out. But again, could you bring it, and whether it's within the rules or not, I don't know. Leftover from the catering event, only 1 specific town said it's okay, as long as labeled and dated. 3 called out, so you can't have it, and the other ones didn't say.
So therein lies the problem, right? So all this homemade stuff, leftovers, no one knows who's bringing it in.
Mhm.
There's no expiration date. Somebody could take it out before the next person goes in and do the temperature check. Right? So there's no way of tracking any of that. And cameras or no cameras, it doesn't probably have very little to do. At least if there was something, okay, they made a lasagna and it's made on today. And there's a way for them to track that, but if somebody doesn't put it on, or even if you mandate they should be, who's watching that, right?
The only comment on that is just, I know you use lasagna purely as an example. It's, if you make something at home, it's supposed to be single use, a single serve. You wouldn't make a pan lasagna.
Right, so they
And
would,
if you did make lasagna, you cut it, you portion it and put it in containers.
So what about if it's a lasagna that I made for my office? And now I have leftovers from my office party, that's different, so that I can bring.
When I leftovers from a catered event, theoretically in that bucket, we'll call it, is made in a commercial kitchen.
Okay,
So it would be the leftover lasagna from Wegmans
right,
at your holiday party.
but then isn't it the same concern now, how long was it sitting on the table in my back office?
Sure.
Before I decided to bring it to the community fridge?
I would be most skeptical of leftovers, just for that reason.
Yeah, That's-
And I see it at meetings that I attend upstairs and, yeah, I get a second, no.
Yeah.
Do the volunteers have data of how much of that food is later on thrown away? It's not being.
I have no idea.
Because even if it is.
I would doubt that there's anything thrown away. And let me say that, I shouldn't phrase it that way. If it is donated really close to the expiration date, it probably would get thrown.
Hmm.
But from what I've understood, food goes in, food goes out, it's quick. I drive by there, a few times a day, or I won't say there's always someone there, but it's not,
Really?
it's an active
Okay,
fridge.
so there is utility in.
But I do not know, I don't have any numbers for you about how many people, because I don't think they know. Even if it's stocked one day and you come in the next day and it's empty, that could have been 3 people that just overstocked themselves. You like to think people don't do that. Who knows? So there is no data. Most towns just, wipe their hands, not wipe their hands, I shouldn't say that, excuse me.
Sorry.
But it's not as their high priority, they post a list and just let it go, and it's not monitored, so we can post every list we want. But I'm not gonna try to track the person down if I found some chicken in there.
What is the junior women's club or organization, what do they say about what they want in there? What-
Everybody I've spoken to,
Yeah,
from the Fitzgerald Institute the first time, this last person, and I honestly forget who I spoke, so I spoke to 3 different people, they would prefer it to just be like, whatever you. Cause their number one priority is food insecurity.
yeah,
And food safety is lower on their list. And that's what generally the people, in whatever research I'm reading, if you go on, you might enjoy this, go on to freevee.com, FREEVEE, which is sort of a French fridge website. They say, don't tell the health department that you're opening a fridge. They say if you're going to stock it with things, do it after they're closed, after the health department's closed. So that's the guidance from like the national organization, kind of.
right.
But that's not really what the grassroots organizations are. What it's for is to address food insecurity.
And as far as we know, there haven't been any foodborne illnesses in our town that could be attributed.
Any research I've done across the country says there's no documented cases of foodborne illness from a community.
Not alone.
All it takes is one.
I mean, they could just go unreported also.
Of course,
Well, of course.
As-
that's-
I think 80% of people. Sit around.
Nobody knows, you don't know what happened yet.
So now you all see why I left it in your hands as opposed to just mine.
Do other communities around here have a food fridge? Like,
Southborough does, and they went on the recommendations that Heather Alker and I did, which was pretty much straight by the food code. Which
They
you
went
can't
by
have the
food
raw, you
code.
can't have homemade.
So they
Well-
know what food code.
What I read about the donations is kind of in the food code. So maybe we didn't go all the way to the food code, it depends on how you want to interpret what a potluck is or what a donation is, or which our organizations are. Shrewsbury does, they don't allow anything.
Hmm.
Hudson allows raw meat and leftovers from catering events.
This is all from the website, so they
These
might
are just from
have, they might have
websites.
additional guidance
Right.
on the fridge, which we can absolutely include. Instructions, directions, guidance, all of that.
Like a lot of it, some of it may have been an article that just says the fridge doesn't have any requirements or something, but if I went there and there might be a whole list on the door, so this isn't a exact science of my research, it was hard, as I drove around.
Do we know deli meats?
That is not called out anywhere, but that should automatically be in. But again, if it's not called out, I mean, I think if I were to make a list, which I would do after this, if we come to any conclusions at this meeting, I'll make a list. And I'll include certainly the things that are absolutely.
You know, how comprehensive can that list be? I mean, you could cover the entire fridge.
But you call out the important ones, which would be specifically deli. I mean, there were some that even call out, you're allowed to have commercially packaged, like your Hormel hay or something like that, that's in the plastic containers. There were some communities that said that was okay.
Okay.
I left all that off the list, I wasn't even noticing you folks. But we certainly, if you wanna make a more comprehensive list, I can certainly come up with something, and we can take this next time. You really wanna go with a deeper checklist.
And there's no permit required for this, right?
They do have a permit.
They do have a permit.
So somebody has the food safety certification. But again, do we need to require a permit? I guess that's theoretically the next question. That wasn't, I didn't bring it, I wouldn't have brought it. They're fine with the food. But if a different organization takes over and they don't have a food safety certification, do we care? I guess that's the question.
Would you know that? Would that be reported?
If they're required to get a permit. Because as part of the permit, they need to submit their food safety certifications. So theoretically, at least one person involved with the organization in charge of the community fridge has that certification. So Vicky Colleen from the Senior Center, excuse me, and Northborough Junior Women's Club has that certification, and she's sort of the person in charge. Even if she's not directly involved, so her communication has got down to people. And the people I've spoken to on the phone, I've also helped educate as well, but they already knew their temperatures, they already told me they had people checking.
So, oh, I'm sorry. I'm supposed to be asking.
No,
Would it make sense to have some sort of annual, almost like looking at the Northport variants where they come in annually to say, we are CPR certified lifeguards, we're following the rules and just giving you an update so that they could have some additional let them work freely to feed people that need it, and so we're not micromanaging, but they are doing their due diligence.
I'm just looking for categories of foods that we kind of gonna just let it slide through. Is that what I'm saying?
Well, it's not right now, right?
It is, well, no, there's no chicken allowed, no raw foods allowed at this time.
Yes,
No homemade foods allowed at this time.
I don't believe anything's posted. It's just sort of.
So it should be.
So we absolutely could. We never got around. to-
I see.
Yes.
There's such a need and more than we probably realize, and I'm sure,
Yeah,
you know, those working to keep it stocked and to watch it daily. That's impressive.
if they're there daily, twice a day,
That's what I've been told.
monitoring what's in there, and what's gone in, what's gone out. As best as they can.
Right.
I mean, if we were gonna specifically allow some of these things or a little bit more of a broader scope, then I can certainly work with the organizations to facilitate some, not food trainings necessarily, but maybe put together a 2-page pack or something to have for them to, all the volunteers to understand of what they're looking for, as opposed to just making sure the food is cold.
And you do biannual food inspections?
Well, what's here,
Once.
just to make sure, it's okay, and it's in running good shape, but.
So what prevents a restaurant from donating to the fridge at the end of the day when they have leftover food?
Nothing. We can call that out too. My list was not this long. It had a lot of other things on it, but I chose just the 3 focus ones, but that's certainly. A lot of places allow you to do commercially packaged, which would be made in a restaurant. But not leftovers, and that's a harder distinction. They're welcome to make, 12
Right,
chicken pies,
specifically.
label it and stick it in, theoretically, that's fine.
Or like say a buffet, right? Now the buffet's done at 1 o'clock now.
I mean, that could just count as the leftovers themselves, because that would need to be thrown there after a certain point. And it can be as detailed as we want it to be, or as Lisa's pointing out, it can be as little, as least.
I mean, they're doing it from the food insecurity point, and totally understand that, and that's fine, I'm all for figuring out a way of doing it, but the safety issue concerns me. And while it's never been reported anywhere, and forget the liability part of it, I think Teresa raised a great point, but if we're, not liable for any of that based on the Massachusetts laws, that's fine and dandy, but I hate for somebody to get sick because of something bad.
Because we said it was
Right?
Yeah.
Because the public is going to think that
It's safe.
this is monitored.
Exactly, and that's my point, right? And I mean, we're here for public health, we're not here for food insecurity. Our first goal is public health,
Well,
right?
that's part of it. That's part of community health is people are food insecure.
Right, but you want people getting sick on our,
No, but it's not, we haven't seen anything pop
nothing's
up
been reported.
yet. So maybe we could just go slowly and rather than. So what we're suggesting here is to create some regulations that weren't previously. So do we just pedal slowly and see how it is, you know, not creating more work for you?
Oh.
This does create more work for you.
I want to do things the right way by the community. I didn't want to make that determination. I didn't feel it was my place to choose one over the other, or my personal opinions, or our personal opinions of how it would go. So that's why I come to the Board of Health for their opinions. You certainly make a great point about where your priorities may lay. I see both sides, and if you ask me my professional opinion, I don't have. Because I'm right, I
It's a tough
understand,
one.
I understand all sides.
We're more likely to see somebody have issues with their diabetes, with their A1C, because they're not eating. Because they can't afford the food, but they need the medication, or they, you know, vice versa. Food insecurity it's under the radar, but it's out there, and no, I know nothing's been reported, and I do share your same concerns about food safety, I absolutely do. But it's a different, you use the word animal, it's a different sphere of community health. And this is a really challenging thing for us. This is, you know, if you say, nope, we're not gonna have fried chicken, we're not gonna have any of those options. I think we're really limiting some of the food options that people need, and you brought up a great point, Glenn, is the people who are boots on the ground, what are they saying? So if somebody there is certified in food safety, even though it's very loosey-goosey, we just start with that and maybe have them report in once every 6 months or something. Does that make sense? And if it doesn't, please, I'm not trying to push hard for that. I just wonder, do we need to create something bigger than what is really necessary at this point? Just go slowly.
Because it seems to be working as is. We don't wanna cut anything out. What are the hours of is the food pantry 1 day a week, or is it?
Wednesday night from 6 to 8 and Thursday from 10 or something.
Very nice.
Thursday night from 9 to 10?
Morning.
It's very, yeah.
Once Wednesday, yeah. Thursday morning.
Maybe there's a way to track who's taking what, or
Who's putting what in?
who's putting what in.
Do we have a sign-in sheet with this?
Comfortable with
You know.
that.
I think it's a confident, I mean,
Yeah,
people
I
are
don't-
going to a food pantry or food, fridge, they don't wanna.
No, I hear that.
To answer your question
Who's
directly,
taking stuff out, but
oh, sorry.
maybe
Who's putting in?
putting the stuff in is,
Right, that's why I asked.
that assures a little
Why I
bit
asked if there's a way to record or.
of accountability
Track
as to what's going in there.
the time they put it in.
Just sign it in,
Yeah.
that way people, you're not gonna take that old chicken out of your refrigerator and go bring it down there, cause you forgot to bring it over the trunk.
It is open from Thursday nights, 6:30 to 8, so only an hour and a half, and Wednesday morning house breakfast from 9 AM to 10:30, so it's 3 hours a week. One night, one day.
But who runs that? The
Karen
town?
Skopetsky's the
Oh, yeah.
director, is that her title? The director of the food pantry. And
It seems
you know a little bit more.
woefully shy of
Oh, sure, I
a
had,
rather large lead,
Yeah.
Yeah.
right?
That I would agree.
Yeah.
the unofficial numbers I had heard is about 30 to 40 residents go to each of those two events. Excuse me, the evening one is about 30 to 40 and the morning one's about 20. So similar.
Yeah,
I mean, I feel like the better solution for at least the raw meats question is to try and provoke Karen Skopetsky to get more volunteer hours at the food pantry to make what we know is safe, because we're bringing it in ourselves, more readily available for the families that need it, rather than risk that at the community fridge.
Well, they're not in charge of the fridge, so they'd be taking the money,
Yeah, right.
the chicken that they've received as donations and
Yeah.
giving it to Same people,
Right,
yes.
but if did you say that the food pantry gets the fresh meats from Walmart or wherever? And
Right.
it go, right, so I feel like rather than regulating and trying to keep an eye on who's putting what in the community fridge, let's get the food pantry to offer some more hours.
Or,
More availability so that we can get these products out so people need them.
or the food pantry stocks the community fridge. Instead of me
I would
going to
only
the,
hesitate to say there's a reason they're not involved.
Right.
I have no idea what that is, that's guesswork, but
really?
So
I don't mean a, like a vendetta or something, but there's some reason, sure.
I think they're at capacity for what they can do, and it is volunteer, and until somebody else.
And I think what opening up to a greater donation level at the fridge is if I wanted to donate. That's a very good question, I'll answer in a second. If I wanted to donate some of my chicken and the food pantry's closed, I can go to the fridge, but that begs the next question, I have no idea what the food pantry would take as a donation. So I had a feeling someone was about to ask that, if I brought my chicken to the food pantry, would they take it?
I would love to know.
I don't know the answer, I didn't even think about that.
And I've left messages.
I don't think-
I don't think
it's
it's cooked.
To
I don't think-
50 people and nobody responds, so it can, and I can respect that. I think it goes directly to Karen's mailbox, and she's busy and only handles so much, so.
And do you do inspection for the food pantry? And how frequently is that?
Twice a year. They're just, they're, every food permit's theoretically twice a year, same.
Okay.
Visits.
Well, I think theoretically we could go on all night about this.
Or we can table it, I can make.
I think we should table it this time.
They do.
And it seems to me that Lisa's brought up a good point that part of the public health is sort of answering this food instability. This is a whole new avenue that the Board of Health and Human Resources could start to look into, because clearly there's a problem here. That this is brought up, at least brought to myself anyway, and maybe we can start looking at it that way. We got all these grants and different programs, I'm sure, are out there. So I would say, you know, without touching this issue at the moment, other than touching upon it, we might wanna look into that. See if we can't find an avenue to sort of find some funding or something of that nature. And
But-
try and
Expand the food pantry.
expand the food pantry.
Exactly.
I think that's
And I think-
a good idea.
Not to expand, not to continue to talk, but I think one of the purposes, speaking as an advocate of the fridge for this moment, that it's different from the civic organizations that are involved with the town and everything, that there's different set of rules. So that the food pantry doesn't take the raw stuff and the homemade stuff, the community fridge will. And I think that's one of the purposes of it, is that people can donate it in a different way.
I
So
see.
just a separate part of the argument. And then I will finish it with one last, obviously, this is one of those situations where maybe food code and regulations haven't quite caught up yet. And I think the Department of Public Health didn't want to touch it for a while, but now they're realizing that so many communities are having them in multiple fridges. In Worcester, there's 5 different fridges in different parts of the city. So I think the Department of Public Health is talking about it, so they might be working on some guidance. I know they've had a few talks about it, so
No, I say we table it for now
fair
and
enough.
circle back around it. A little
Sorry,
more
if
thought,
I'm thank you.
a little bit more thought into.
Fair enough.
Okay.
Sorry to take so much time.
No, it's interesting. Glad you put in the first thing.
Oh, yeah, we
A second.
just getting rolling now.
All right, accessory dwelling unit.
Do we all know what that is?
No.
I've heard that term, yes.
See anything
No,
like
if you could give, yes, if you could.
Oh, I haven't heard it.
So at the moment, there are different areas of the town that have different zoning laws. Some places allow commercial, so forth and so on. And where we all live, or I have no idea where we all live, excuse me, if we live in a typical residential neighborhood with houses, you are allowed to have your house and that's it. You could not put an apartment over your garage because you're only zoned as a single family area. The Healy-Driscoll administration, in an attempt to combat housing issues, they're now allowing what's called an accessory dwelling unit, which is an apartment over your garage, a small home in your backyard, subdividing your basement as a rentable unit. Or a purchasable unit, depending if you have a separate structure, someone could actually buy it. So it's going to address housing needs in general, and maybe help the economy with more money coming into various so forth. Why this is a big deal is because the administration said anybody can do it regardless of zoning laws. So you still have to, so the zoning laws, I said, if you just have your house, you can't put an apartment on it. Now you can. You can build one over your garage, you can subdivide your basement, and you can have two rental units with no approval necessary by the town or the state. You now have it by right, as it says. You still have to follow building codes. You still have to follow health department codes and so forth. But the zoning part of it, that you can do whatever you want, is more or less wide open. There are a few restrictions, more on about the size of it. It can't be more than half of the gross floor area of your dwelling. Or 900 square feet, whichever smaller. It's kind of it.
He's on Summer Street.
Okay.
If you turn on Summer Street from 135,
Yep,
a few houses down on the left, there's a gray house, and right behind it, they brought in a small.
Oh, that one, yeah.
trailer home. Is that an accessory dwelling?
Yes.
there?
so
Okay.
as of now, if zoning allows it, you could have an accessory dwelling
Yeah.
unit, but it has to be owner occupied.
Yep.
You can't rent it. You can have your in-laws live there or your sister or something like that. It has to be family. But as of February 2nd, 2025, you do whatever you want.
Okay,
Within reason, say whatever you want.
and I assume that if I have a 4-bedroom septic and I already have 4 bedrooms, unless I upgrade my septic or get rid of one of my bedrooms, I'm not doing
You
it.
read our-
That's the main reason I'm bringing it up to you. We're not looking for any input or we're just letting you know that this exists.
So the Department of Public Health has announced that they're gonna come out with regulations, so hopefully it kind of touches upon that septic system. We just wanted to make sure everyone was aware of this coming down the pipeline and, update as needed.
And so what you're saying is that, so if you have a 2-acre property and you have septic and well, and you wanna put a 2-bedroom house on the back of your yard, you can do that and sell that.
So it's-
I'm a little fuzzy on the selling, that's what I've heard.
It's still going with the zoning minimum requirements.
The zoning rules of the cities and towns won't matter.
Oh.
The
So
city's
is
gonna
it-
supersede the zoning.
Is it all the zoning rules, or is it just that zoning regulation that says no accessory dwellings? Because I would think that you would
No,
otherwise.
if you're in a residential area, like I live off Northgate,
Yeah.
which is just a residential area, I cannot have an apartment.
Yeah.
The new rules say you can.
Okay.
Yeah.
But you still have to comply with other zoning.
Building codes.
Building codes.
Building codes.
Well, those aren't
Yeah.
zoning, so I wasn't sure what you meant.
So like setback requirements.
Yeah, all that
You
was
still have
so,
to comply with setbacks.
unless,
Minimum.
not saying this
Minimum lot
as an
size.
example,
regarding-
if it's a ADU, an accessory dwelling unit that is adding a second septic system, we theoretically could make a
Yeah,
regulation that lowers the setbacks or things like that. That's not what I'm asking, we're not there yet.
right. That's interesting.
But again, with any regulation, we're allowed to set our own regulations that make things stricter, not
Yeah.
less strict.
Right.
And Title V is pretty strict. So there may be nothing for us to talk about later, because Title V is Title V. But I have already had a couple calls that says I was thinking of putting an ADU, there's not room for 2 systems, can I put in a tight tank? A small little tank just for that unit.
Mhm.
Well, Title V says absolutely, it's completely against them for new construction. Period. So the answer is no, but is DPH maybe going to allow something like that, or
Yeah.
I don't know. They're just sort of letting you all know that as the Board of Health and Septic Authority, we might have some conversations in the next few
Any
months.
cuckoo, all right.
As Isabella mentioned, we're going to that conference this week and Title V is, there's always part. They're probably not gonna address those, but I'm gonna be in a room with 50 other health directors worried about the same things.
Then why
So-
bring this stuff up? You just.
We should have waited.
Hold on,
This is just letting you know about it.
Bring this list
Well, I have a feeling the community
It's
fridge
just-
is doing fist fights.
Even number
that
four
could
looks
go
like the
from-
same thing.
Yeah, and number four
It
is
is,
another.
it absolutely is, so.
It is.
Animal keeping regulations.
So that, I just wanted to add onto the agenda, is this something that the board has ever discussed? The town of Northborough, the health department has no animal regulations.
Urban farming
Yes.
has come up in the past.
Okay,
And it was started with the chickens. Horses we handled, but
Yeah.
chickens, and there was one kid in particular who had more pets
okay.
than he could handle. They were all, right, they could have the donkey and everything else, the neighbors were really upset about it.
There were reptiles too. This was, I think, 5 or 6 years ago.
Did what?
Reptiles.
They don't bark or anything.
Yeah, but there's ran with a toe, summertime, you'd be a little freaked out by us.
So we spoke about it and then discussed it and then decided it wasn't really a big enough
Okay,
problem to step in.
okay,
Northborough being an agricultural community.
yep, is that how we all, so feel I'm totally
Are
fine
we
with
a to farm community?
I don't think we're right to farm, but we're born on the back of an agricultural society.
Yes, sir, yeah. Okay.
But no, we're not officially.
We're not, okay, because I know when I was on the planning board, we thought we'd want to do that, and then it just didn't take off, so.
So
Yeah, so we never.
I don't think there was enough problems
Okay.
with it.
I'm problems now.
I would say like maybe 2 a year, I don't think it's, so I just wanted to bring it up.
Excessive
Chickens are-
barking.
they're everywhere.
dogs.
Chickens are the big thing, right?
Chickens.
Yeah.
I think there's a
Eggs.
particular number
Alright.
of chickens, right, you can have, no? Some towns
So
have.
now,
Some
they have
towns
these
have
eggs, they just put them out,
Yeah.
eggs for sale, here they are, they're in the,
Up in the
we
refrigerator.
don't know where they came from.
So we'll keep that on the back burner in case there's more issues, but cause it would be a long process, it would be.
Yeah, no,
and
it'd be a
this
whole
level.
thing,
Is
discuss.
this gonna be discussed at the conference in Springfield? Phil?
I think people who have this habit, if they don't
Yeah.
see it as a need, it's not a need. So I just wanted to check. in.
Anyone else have any issues with reptiles?
Turkeys.
No, I don't know.
There are 4 turkeys that are terrorizing.
Oh, those turkeys.
I lived out.
That's because you live across the street from
They
them.
terrorize
They're all-
all the drive, like I know when I'm around because there's people honking. Otherwise, it's a quiet.
If you get out and chase them, they'll run.
I know, I chase them all the time for people.
Like,
What's that turkeys?
No, why not?
Well,
Oh, wild.
what do we do about this?
They're like, they're gone by.
These regulations wouldn't.
No, they're gone by like 12.
They don't belong.
Abandoned.
Are they having eggs? Are
They
they
belong
having
to you,
eggs?
if they belong to you, then
Just
that's.
Oh, really?
Yeah. There was 3 males and then a female joined their pack, and then I've now seen a pack of 4 females also, so I don't know, but they're never together, thank goodness.
So there's another gang on Brewer Street,
Yeah.
Brigham Street, excuse
It's,
me.
You should come to then my street, there are at least 10 or 15.
Yeah,
Yes,
they
you
do.
just,
They
yeah,
might
you
find
just
out.
wait patiently
They're at the bird
while they
feeder.
are, fanning out.
But the ones on Otis across from her house attack the cars.
They do.
There's a line of 10 cars on both sides, waiting while they're attacking the cars.
I've seen them like chase
It
cars
was-
down the road.
Well,
It's
give
crazy.
it a week, they'll
Chase
disappear.
cars.
Alright, so we're good, well, unless
Yes, we're
unless
fine.
things come up.
It'll be nice and quiet.
Yes, they know what it's coming. Okay. Discussion of food permit for the dugout corner.
Another issue I want to make is, I'll leave it in your hands. Could something a little new. So let's say, for example, there's a brewery that does not have a kitchen or any food service. No, according to the Department of Public Health, there's no food permit required if they allow you to order food from Shangri-La and walk in and sit down. No problem. There's a new establishment called the Dugout. It's gonna be open in the building right next to the Hillside Grill up in that weird little plaza
Yeah,
up there. They're gonna have virtual cricket and baseball. So you and your family can go, with a VR headset. Actually, I don't know exactly how it works, but I believe a VR headset of some sort, and you can play cricket and so forth, and baseball. And I believe a ping pong table. They do not have any food service, they don't have any kitchens. And they wanted to do a similar process as I just described. However, they want to be the ones that facilitate the order. So rather than you calling up and ordering your own food and bringing it in with you, you would walk up to an employee of the Dugout. Say, I would like to order 2 burgers from Hillside. They plug it into their computer, take your payment, which includes a surcharge. So a $12 burger now is $15 or whatever the markup is. The order will go to Hillside, they will make it, bring it to the dugout, hand it to a dugout employee, who will then bring it to you. So when I heard that, I said, I wonder if they need a permit, because they're facilitating the order, being the final deliverer of the food, and adding a surcharge. I don't know.
But-
And when I asked the Department of Public Health, they said, oh, they may need a permit, it's up to you. So now it's up to you.
So they're literally hands-on this food.
The restaurants that, at the moment, and this is something that I'll work with them, depending, the restaurants currently that they have this partnership with is the Hillside Grill, which is literally next door.
Right.
And then Shangri-La, the Chinese restaurant down here, that does already deliver. So they already have hot bags and a process for what they're doing. So I forgot what I was saying, forgive me.
Plates, forks, knives.
Theoretically would be delivered. No dishwashers would all be plastic utensils.
So
Um,
what prevents a customer who's playing cricket or whatever they're doing to pick up the phone and call from Shangri-La or call from wherever, they can do that, right?
well, they may have a rule that says no, but from our standpoint,
Okay,
theoretically,
so that restricts customers from ordering outside on their own, they have to go through the dugout.
that was purely.
But that may be
conjecture,
part of
I
the
do not
issue,
know.
right? Because if they say, well, no, I can order from anywhere, or no, you have to order from these two places, that means they are taking the responsibility saying that these are the only two places, they're gonna make a surcharge out of that, right? So they're restricting their customers from going outside,
I don't know that for a fact, but if that would be the case, I thought
and they should be permitted,
that would be the case.
then they should be permitted.
If they're-
That's an interesting take, if they,
They're
But they're-
benefiting, they're getting surcharge.
Yeah, they're getting surcharge from that.
I don't think they should be permitted.
I don't think.
They're not
so
making
either.
it, it's coming from a places that are already permitted. It's the same as a DoorDash coming to your house.
Except there's.
They're not making it, they're not giving you silverware or anything. They're just part of their
Is it a
service.
restaurant? No, nothing, any beverages?
their website says they do, but they don't.
They don't.
Their website is very strange, it's very, it says they have beer, wine, cocktails, and all, like a huge list of restaurants, which is.
It's a little virtual beer wine. Virtual.
They just haven't updated it yet, but actually I haven't looked at it in a few weeks.
Do they have a liquor license?
No,
Oh,
no interest in it,
really?
their website just, maybe they had a different plan when they first thought of the idea and just never updated it. So yes, to Glenn's point, it's just.
I don't see any, they're not even opening the bag, so you get the bag from Shangri-La. Here's your order, Mr. French, have a good day.
Yeah.
I think that would be perfect, that's my opinion. I don't see any food safety issue.
I would agree.
Yeah, I would agree too, I think it's capitalism at its finest.
It really is.
I don't know.
It's
Take a buck off of nothing.
Yeah,
Yeah,
see how long it lasts, it's interesting.
Yeah.
I guess we don't have to regulate everything, right? Really
No,
wanted
you're
to
not
regulate
problems.
everything, so.
It seemed like, when I first heard about it, it seemed like I could make an easy decision, I was prepared to, but then I questioned it, and I asked
Yeah.
Isabella, and she didn't have a good answer.
Well, then we
I
went through a
understand.
whole rabbit hole of DoorDash and the food safety
Mhm.
with that, which.
Right,
You get
but that's
to
gonna
roll.
happen between the restaurant and the dugout, that's not even happening at the dugout, that's gonna happen before it even gets there.
Right.
I mean, it's-
And it's not our job to determine the financial liability if something happens,
Right,
we're just trying to protect the health.
I think from a safety point of view,
yeah, I would say let's wait and see how the operation actually goes. Cause you may change your mind in the future and say, you know what, you do have too much involvement in the food product at this point. And so you may change your mind, but I think for now, if it's showing up in the bags and they're literally just doing this.
And there's no microwave in there for them to reheat stuff or anything like that.
But just be you and your family will bring pizza, not they wouldn't have pizza. But, you know,
Well, pizza's not on the list, sorry.
And the
If
food
they're
can
not
be
opening the
pre-ordered
bag,
a day
I don't
before
see it.
and
Yeah.
it's there. Like say there's a birthday party, they order like few hours ahead of time and
I didn't
keep
ask
it
that
there,
direct
store
question.
it there.
According to the website, they have, you can order platters and so forth, but I think that's. I don't think like the hillside's prepared for that. So I think that's just what the website says as opposed to reality at the
I
moment.
think the benefit of this too is when you get takeout, it has to have a label with the time.
Mm.
Which would help to some extent. I mean, you can see in 3 months, you know,
Especially if he starts to expand to restaurants that either don't deliver or his people will go in to pick it up or something like that, maybe it can change. But at the moment, Shangri-La will be the one delivering and Hillside will just walk across the street.
Just it's one of those two places.
The website says, our wide array of restaurant partners or something like that. So when I asked him about it, he said his goal is to partner with more, because I think,
Yeah,
I don't know this for a fact, but ideally you're having like Toast, the provider of the software, integrated so that they can get your order. So I think if you can get C'est La Vie and Lamia Lamai on board, then they'll be happy to, I'm sure, to get the extra business. But
yeah,
I assume the Duggins are gonna call them, place the order, that's just an added step. So as long as they can get the technology to work.
Right.
I presume. I mean, it certainly didn't seem too
Restaurant that
complicated, but it
doesn't have
seemed
to
gray enough.
cook. It's perfect, it's a perfect idea. Well, except for the cricket part, but aside from that, I'm on board.
I'm sorry.
You can play baseball.
Is there a big underground cricket thing going on in North Carolina?
no, it's not.
There is?
Wait, are you thinking?
No, I'm.
Okay.
Although it was.
It's not a wording, but
Open a cricket community, like a bunch of cricket,
it's like cricket leagues around.
There are lots of things and.
Really?
Especially by recent.
Soccer fields on Westboro, they rent out on Saturday morning.
It's massive cricket games, they came out of their group, after the US came out of their group, agreed.
Yeah,
I think we should have a next meeting there.
Gotta get out
We're
of
gonna
that.
get out of the house more. I mean, I apologize, but they
You'd be an
got
excellent bowler.
all cricketeers up there.
Do you want a formal vote on that? Or do you want?
You need one? Yeah, I'd say, why not?
Okay.
I'm gonna move that, after careful consideration, the dugout corner, as it is now, does not require a food service permit from the Board of Health.
and that we can reevaluate that in 6 months.
To be reevaluated in 6 months.
Second,
All those in favor?
Abstain.
Abstain.
Yeah, that is.
We got that? Good? All right,
Thank you, board, for your
I know,
input.
it was the Michael show today, the environmental health.
really going on. Here's something we can all do. Approval of previous meeting minutes. We want May 14th. Delete Lisa and Teresa.
I had no changes.
Yeah, plan changes.
And I would make a motion that we approve the May 14, 2024 minutes as written. I second.
In favor?
Aye.
Aye.
Unanimous. We go on to, what's the next one? June.
11.
It's me, myself, Lisa and Teresa. I read them and I didn't see. Okay, I move that we approve the Tuesday, June 11th, 2024 minutes as recorded.
Second.
All those in favor?
Aye.
Aye, unanimous. Lastly, we've got Tuesday, September 10th, 2024. It's myself, Lee, and Lisa.
One pager.
Good,
Love that.
very nice. Let's see. And that was when we did all the meetings, so.
Yeah. we can see it. Very good for me.
Okay, I don't have any,
No, I would say.
Lisa?
I have no problem with that.
Alright. And I move that we approve the minutes for Tuesday, September 10th, 2024 as recorded.
A second?
All those in favor?
Aye.
Aye. Unanimous.
Clear. Got 5 minutes to do all 3 of them.
Did it well. Anything else?
Yes, actually, one very small thing. As the board knows, I am the voting representative for the Public Health Emergency Preparedness Group. I attend meetings every month. And I guess there's a letter that we need to have signed that says that I'm continuing on. Last year, Angie upstairs signed it, so I didn't bother anybody, but now there's sort of evaluation, so wait a minute. The Board of Health is supposed to sign this,
Okay,
so if Glenn wouldn't mind.
I don't,
We want the job.
Meetings
I
are,
think he's the person for the job.
these meetings are pretty basic, pretty simple. They're usually offsite, so it's fun.
Yeah, I keep getting the invitations every.
It reads, to make concern, Northport Board of Health designated Michael Seeger as the primary voting member, PHEP Region 2 for FY 25.
Alright,
It's simple as that. We did go to treehouse once, but they didn't serve anything, which was fun.
Anything else?
congratulations to you again.
Hey,
Yes,
All good,
congratulations.
oh, it was perfect.
perfect,
Beautiful
good,
day.
great weather,
Yeah.
Yeah.
We strolled around Europe, so,
Yeah,
even better.
backpacks,
no,
staying clear of the moors.
no, it was great, but yeah, we'll be just continuing hiring, training and making sure we're fully staffed and still looking for that nurse and social worker to complete our teams.
And looking into that food
Yes,
Pantry.
food pantry,
insecurity issue.
we'll talk more about the community fridge, accessory dwelling units, we will let you know if we hear about anything. And everything, we've decided it's not a priority right now, and then the dugout, we've agreed that no food permits necessary, but we will reevaluate in 6 months.
I think we need to visit it.
Try that.
Greg needs to go there and learn about it.
I can't believe,
They're opening soon, they want to open really soon, so
oh, they're not open yet. No, it's,
like a week or so.
I'm ready. Gives me time to practice. It's virtual too. It's like the Y, the
Yeah,
the Y or the we.
Yeah, we.
We is what's Y.
Nintendo Wii.
It's called that Y, we.
Yeah, I do too.
We don't have any of the things, but we get the box. All right, that's good. We'll establish a tentative future meeting, December 10th. And if anything comes up, otherwise we'll see you all next year.
Perfect, you
We'll make a
wanna-
motion to close the meeting.
I move that we close the meeting.
Second,
All those in favor?
yes.
Everybody.
I mean,
Yeah.
can I say no?
Yes.
Yeah, you're still up. You're still up, hold it.
By all means. Tell us your cricket stories.